So the first speaker we have is Lise Grande, who's the UN Resident Coordinator and UNDP Resident Representative for India.
Thank you, Doctor. Good afternoon, and many thanks to the organizers of this seminar for inviting the United Nations to be here. I'm delighted that I'm on the podium with Poonam, who's a close friend and who's taught me personally an awful lot about both education and health in India. What I wanted to do in my very brief comments was to first of all talk about the obvious fact that education outcomes and health outcomes are coincidental with each other. I then wanted to talk about the corollary of that point, which is if the outcomes are coincidental, doesn't it make sense to program them in a simultaneous and coincidental way? And the answer to that question is yes, in some cases it does make sense. But in the third part of my, again, very brief comments, what I wanted to reflect on is actually reasons why programming health outcomes and education outcomes together, in fact, not only is extremely difficult, but may not be worth the effort. Let me start first with the initial point about why health outcomes and education outcomes are interdependent. I think almost all of us realize the self-evident fact that if you are healthier, you learn better. And equally, if you are well educated, the statistics show that you are much likelier to be healthier. There is a relationship between them that is, in terms of evidence, lockstep. If I can perhaps just reflect on some of the statistics that relate to countries who are in the global south, statistics show that a child who comes from a mother who can read has a 50% chance of survivability past the age of 5, 50% higher chance of survivability. In the Philippines, for example, mortality rates of children are 50% lower for women who have a primary education. It's a conclusive statistic. A child, likewise, with a mother who can read is at far less risk for malnutrition. Across the global south, in fact, the statistics show that on average, the children of women who have a primary education are 22% less likely to be stunted or malnourished. The statistics are also absolutely clear that girls who stay longer in school are able to delay marriage and childbirth. In fact, a very recent study by the United Nations Population Fund estimates that adolescent girls are up to 5 times more likely to die from complications of pregnancy than are women in their 20s. If you can delay marriage and you can delay pregnancy, then the health results are important. I'd also like to point out that women with post-primary education, in other words, who have actually made it into the secondary levels, are 5 times more likely to be knowledgeable about HIV/AIDS than are illiterate women. And then the fourth statistic that we'd like to share with you has to do with vaccination rates. And here the evidence is truly impressive. Health surveys indicate that children are vaccinated. If you have a mother who is illiterate, about 19% of children manage to get vaccinated. If your mother, however, has simply a few years of education, then 68% of those children get vaccinated, 19% compared to 68%. So it's quite clear that what we're talking about is, as I said, a coincidence between health outcomes and education outcomes. That being the case, many specialists who work in education policy and health policy have said, well, why don't we try and at the same time program our education work and our health work? So, for example, in schools, have programs focused on improving health. There are, in the Global South, a couple, in fact, there are 3 types of programs where the evidence says this makes a lot of sense. The first type of program for this makes the sense is school feeding, where you have in schools feeding programs that are aimed at ensuring that children receive at least minimum requirements for the day. School rates go up, attendance rates go up, children are clearly much healthier. World Bank recently did a study of 20 countries in Africa, and you can't dispute the results. That's a clear win. Another type of program where you see, again, decisive evidence is deworming programs inside of schools. The recent work that's been done by the UN on this shows that when children are dewormed in schools, in fact, the number of days that they attend school increases by 15. Okay, so that's another clear win. A health program on deworming inside of the school system has this very impressive result. And then a third type of program, a health program inside of a school where you see very clear results, is when you teach sexual reproductive health programs. And here the impact is that young people, and again the evidence is decisive, the initiation and frequency of sex is better, the number of sexual partners is lower, and contraceptive use is much higher, all leading to a better health outcome. Okay, so those are three examples of where it does make sense to have health programs and education programs mixed, where the twain shall meet. There are, however, very good reasons why you probably don't necessarily want to, in all cases, have health care and education programs at the same time. But before I give you that example, let me, by way of antidote, share with you in the case of India, where this type of programming has run afoul. There are two very important government flagship programs, one of which is called, well, there are many, but of the many, the two I'd like to share with you, one of them is called the Adolescent Education Program. It's run by the Ministry of Human Resources Development and NACO. A second one is called the School Health Program. This is implemented by the Ministry of Health and Family Welfare. Both of them are implemented in schools with the same common goal. They are, however, administered entirely separately from each other. Neither of those programs is showing anywhere near the kind of results that the designers of the programs or the administrators of the programs had hoped for. And this leads me to my final two observations, which is why programming health and education at the same time doesn't always work. The main reason is because these programs are administered in separate ministries. Education programs are in the ministries relevant for that. Health programs are in the ministries relevant for health. We should never underestimate how difficult it is to work across ministries. We all say that it's important. We all know that. We all pretend that there are adequate coordination mechanisms across the ministries which will ensure that the programs can be synchronized. In point of fact, this never happens, raising the questions about whether we should ever embark on something that we know from the beginning won't work. Any program that requires you to work across ministries when you do not have the coordination mechanisms in place to ensure its success needs to be reconsidered. The next point has to do with the poor teachers inside of the classrooms. These underpaid, overburdened, stressed teachers. You start loading those teachers with additional responsibilities. And again, the evidence on this is conclusive. Their performance goes down. We already complain bitterly about the fact that teachers aren't doing their jobs in the way that we expect them to. And then we come in and say, oh, and by the way, we'd like you to do this kind of a program and that kind of a program. We load them. The transaction costs on the teachers who are already trying to do a very difficult job become unbearable. Let me give you a final example to underline that point. You may be aware that the government of India has launched an ambitious program to provide adolescents with a weekly iron folic acid supplementation. This will increase their health levels. Now, the feedback from this program across the country is that many teachers feel that distributing the tablets is an additional task, and that neither they nor the students and parents see the value or the need for iron supplementation. So, as we talk about synergizing between health and education, the fact is that we have neither the governance nor administrative measures in place to do that, nor the people who are supposed to necessarily be the beneficiaries of this kind of program either see the value or are prepared to bear the transaction costs that would be required for it to be successful. Those are just some of the observations the UN would like to share with you. Thank you.